Hi there. My name is Dr. MaKenzie Paulson.
And my name is Martika Muniz, R.V.T.
And we both work at the Anamosa Veterinary Clinic in Anamosa, Iowa. We're here today to talk with you guys about careers in veterinary medicine and a couple of different routes you can take within that career. So within the veterinary profession, there's really a lot of opportunities. We work in private practice. There's also corporate practice. And that's just basically, your family doctor type. You can also work within research facilities. There's a lot of opportunities within the military, food safety and inspection. Within the equine industry, you can work with race horses, performance horses, even, you talk about the zoo or aquatic industry, like marine biologists and marine type veterinarians. A lot of people end up working within academia, so within the colleges or universities, teaching kind of the next set of veterinary professionals. And there's also opportunities within, pharmaceutical companies, veterinary equipment, that kind of thing as well.
And you'll kind of see during the presentation, a lot of the veterinarian and the technician, it's kind of a similar relationship in most of those kind of different professions you could do, whether it be at a university or in the military or working with horses. The technician is still going to be kind of assisting the doctor in a similar way as we do here at the clinic.
So some important workplace skills that you kind of need to work in this profession. Communication is really important, because even if you may get into this job because you love animals, every animal is attached to a human. So you have to be able to talk to people. Also, you have to be able to work with your colleagues and coworkers. And you need to be able to collaborate with those coworkers, and everybody's working together towards that common goal of taking the best possible care of your patient together. And so that takes a lot of just kind of thinking on your toes. You got to kind of find where the need is and meet that need. There's not going to be someone there to kind of babysit you and hold your hand the whole way. You kind of have to be self-driven in that respect. And you have to be pretty willing to be flexible, because the work and the hours of a vet and vet tech, we deal a lot with emergencies, and our schedules change at the drop of a hat. So being willing to go with the flow is really important. And just being able to work hard and just stay on task to get the jobs done. So kind of a day in the life of a veterinarian. This is just kind of a snapshot of the beginning of one of our days. We'll kind of go through step by step some of the things that we do on a day-to-day basis, and the differences between the veterinarian versus the vet tech, and what our job duties are. So to start off with, we're in a mixed animal practice. So we see both large and small animal appointments. Within the small animal appointments, as a vet, my job is to, number one, talk to the clients about taking care of their pets. Obviously we give things like shots, immunizations, we do our physical exams, we do provide that emergency care if needed, and we need to be able to effectively talk to the owners about what's happening with their animal, and going through and explaining in easy terms to understand what the diagnosis is, treatment options, and what medications we need to prescribe.
And technician, it's kind of the other side of the coin. When the doctor is prescribing medication, the technician is getting those ready. When the veterinarian tells the client, about a disease they may have or a treatment plan, the technician will go in afterward and make sure the clients are kind of understanding all the different things that need to be done. And then during those appointments, the technician would be in charge of restraining the animal so it can be examined, so it can be vaccinated. And then kind of on the same side, if the different diagnostic things that are needed from the veterinarian, that's what our job would be as a technician. If they need to know how the urine is looking, it would be my job to go and collect that urine and then use our machines to run it and see what's going on in there. And then same for x-rays. If the doctor needs an x-ray, it's the technician's job to go and take that x-ray and do it properly and do it so that they can visualize all the different things they're trying to see off of that x-ray. And same for blood work. So just all of the diagnostic work that a veterinarian would need, it would be the technician's job to get that and prepare it. And then, yeah, and then also kind of whenever they get to the end of the appointment, again, talking about how to give the medication, the frequency and whatnot. So, and then as a technician, these are kind of the different things I would be doing, just general restraint, blood collection, and then an example.
Oh, this is kind of a fun video. So this was one I had in the other day, a little kitten that came in for a wound on it, and we ended up finding a botfly larva in there, also called a cuterebra. So this is kind of the fun stuff I get to do on the job. We have a little video. So this is me removing a little larva from a kitten, and there's our little cuterebra larva, still kicking around. Those are the little joys in life on the job. Another good example is, this is a patient that we recently had. His name's Little Guy. He's an 11-year-old Yorkie that showed up for routine dental, but his owners kind of had mentioned, oh, hey, he's losing some weight. So we had some questions about that. And so we ended up doing some pre-anesthetic blood work, which we ended up finding that there was a reason why Little Guy was losing weight. This is an example of what some of the blood work looks like. And you'll see some of the values are elevated. That's a reflection of his kidney function. And based on that, we decided we needed to get some urine. And so this is showing myself and Martika. We're collecting a urine sample using ultrasound guided technique called cystocentesis. And we there's a picture of the ultrasound. There's the bladder on ultrasound there. And we collect it sterilely with a needle and a syringe. And so by putting kind of our heads together and getting these results, we were able to find the reason for Little Guy's weight loss and developed a treatment plan to try to get him on a better track.
You can kind of see in each of those videos, her job is to kind of do the fancy diagnostic part, and then the technician's job is to kind of make sure the animals are being held properly to be able to get whatever samples or work they need done. And then this is some of the equipment we work with, one of them being x-rays. We would wear kind of a lead vest with a thyroid shield, and then the animals are restrained on the table to get those x-rays.
This is an example of some x-rays. The top picture is of a kind of a pretty normal looking heart and lungs on a dog. The one below there is a cat that shows more of the, not only the chest, but also the abdomen. And it kind of shows you there where some of the different organs are. And so imaging is really important for us in being able to analyze those things, which yeah, it's just kind of a fun picture to see. Here's some other fun pictures of some abnormal things that we would find. That upper left is one where a critter swallowed a spoon, as you can see, which that ended up we needed to go in surgically after that. The one over on the right side, that is a picture of a animal that ate a bunch of hair ties, rubber bands. And you can see that in the little white squiggly lines in the stomach, and then off to the lower left, those are the hair ties that have been chewed up and removed surgically. So.
And this is some more of the equipment the technicians would use to run the different tests that we need. You can see on that right side, we have kind of a couple of blood machines and then some machines for your urine there. And then on the bottom left, we have laser. That's really good. It's newer, where you can do laser therapy treatment to kind of help with pain and healing. And then you have up there the needle and kind of different vials we would use for blood collection. And then we also, you saw the ultrasound, where the doctor will use that a lot, or a technician will use it to also collect urine sterilely out of the bladder. And then the microscope there we'll use looking at dogs' stool samples to see if we can see any parasites in there, and then different kind of blood specimens you'll look at also.
And so those are some examples of things we do on the small or companion animal side of things. Being on the large animal or production side, so we do physical exams and treatments on livestock as well. We do herd work, so which includes, checking animals for pregnancies, vaccinating, castrating, dehorning, kind of the basics there. In the springtime, we get called out on a lot of OB calls where we have to assist in delivery of primarily baby calves, but also lambs, goat kids, that kind of thing. We do lameness evaluations and hoof trims on animals, emergency calls for treating wounds, bloat, colic in horses. This is a picture where Martika is helping me hold a goat that had a broken leg, and we were applying a splint to it. And so that's a good collaboration between the two of us there. This is a picture of our haul-in large animal facility in the back, where we have the red chute is a hydraulic chute that we can work cattle through. The green chute on the top is a rotating chute that we can put animals in and then rotate them on their side to work on their feet. And this is a picture of a dosing syringe that we use for vaccinating, especially when we're doing multiple animals in one visit.
So unlike small animal, a lot of my job on the small side is to restrain the animals, but for large animals, I'm not able to hold a cow down. And so that's why we have those type of chute systems where you kind of have something large that can hold and restrain them for the vets to do their various work on them. And then for the smaller animals, like little piggies and chickens, I can restrain those to be examined and worked on. And then for the larger animals, a lot of the technicians' work is to kind of just organize the different vaccines, the different ear tags. Technicians are able to kind of help give the vaccines. And so when you have that gun in the previous image, I could kind of help be doing that while the veterinarian is doing something else. And so a lot of it is kind of organizing for the veterinarian, because a lot of times in these herd work, they'll be doing like 60, 90 head of calves or cows. And you kind of have to have organization to be able to kind of get that done in a timely manner.
And so another big part, and one of my favorite parts of being a vet, is performing surgery. And so on the companion animal side, this is a picture of myself. I'm doing a surgery on a pyometra, which is basically a fancy term for a uterine infection, where we're removing a uterus on a dog. Spays and neuters are kind of the really core of what we do. We do some declaws on cats. We're starting to get a little bit away from that. Do a lot of removing lumps, bumps. Every now and then we'll get an amputation of a tail or a limb for some reason, like an injury or tumor. We have to remove eyes sometimes. Obviously, perform laceration repairs. We do have a few vets in the clinic that do orthopedic work, where we will fix fractures using plates and screws, repair ACL ligaments, that kind of thing. Just general soft tissue surgery, exploratories like we showed you, where we have to remove foreign bodies like the rubber bands, or go inside an animal and take biopsies or remove any internal masses. And then we do quite a few C-sections or cesarean sections to deliver puppies, kittens, and even C-sections on the large animal side with cows and sheep and goats.
And so the technician's job during all of that would be to surgically prep those areas that the doctor needs to work on, shave the area, scrub it, get it kind of antiseptically ready for them to be able to work on it, get all of their equipment out again, having that organized so that the vet can just come in and do their surgery and the animal is prepared and sedated for that to happen. And then during the surgery, the technician would be in charge of monitoring the patient, making sure that it's breathing okay, its heart rate is okay, because you do sometimes have times where the animals need you to breathe for them, and we do have them intubated with an endotracheal tube down their trachea so that we can control their breathing, and we can control the amount of anesthesia that they're getting. After surgery, it's also our job to recover the animals, make sure they're waking up okay, that their temperature is okay, they're kept warm, and then get all of the paperwork and medication ready for them to go home on. including talking to the clients about how surgery went, and how they should continue at-home monitoring and what medications to give when they get home. And so kind of all the behind-the-scenes paperwork cleanup part would be the technician's job. And then a good example of how we work together during the surgery is with our dentals. And here's some more images of kind of what my job would be as a technician. I got kind of some of the different vials medication we would use to sedate the animals. My job would be to put the tube down their trachea like that. And then there's our anesthesia machine and the table where we would hook up the animals.
And so with dental work, dentals are a big part of our job and taking care of especially our dogs and cats' overall health. This is a picture of some of the tools that we use, some dental elevators, probe, and a pair of extractors. This is a picture of one of our dental machines, scaling the teeth. We have to scale all the tartar off to be able to evaluate them appropriately. And then this is a picture of a little dog that had some yucky teeth. We do have a quick video of what it looks like to kind of extract some of those teeth. And well, we also do things like dental x-rays that are coming up here too.
And so, like she said, with cleaning up the tartar and plaque, that would be the technician's job to kind of go in there, clean up the teeth, get off all that kind of build up. And then taking x-rays after that are really helpful for the doctor to be able to see what's going on underneath the gums. And here we have kind of the x-ray machine we would use. It's very similar to the one they use in the dentist office, except for I don't get to use a cool little kind of bite wing guide that shows me kind of the different angles they use at the dentist. We kind of have to know how to get our image to capture what we want.
And this is a fun picture of some dental x-rays. The lower left shows one of the big molars that has some bone loss occurring around that molar there. And then the other one on the right hand side of the screen that shows there's the two major canine teeth on the bottom jaw, but you can see that there's some bone loss and we're missing a lot of teeth of those lower incisors there. So here's a video of removing the canine tooth on this little puppy. This poor little dog had some pretty major dental disease, and a lot of his teeth were very loose, but he's going to feel much better getting those out. So talking about kind of education and what it takes to become both a veterinarian and an R.V.T. So for my part, what I did is I went to 4 years of undergraduate at Iowa State. I myself majored in animal science, but we had people within my class that had majored in animal ecology, biology, biochemistry. We even had some people with 4-year computer engineering degrees. I mean, you can really do it with any degree as long as you take all the pre-vet requirements. And then after you finish those requirements, you attend 4 years of veterinary school. Now there's a lot of opportunities here within the continental US, or some people, there's some veterinary schools down in the Caribbean or even in Europe that people go to. And you have the option after you finish those next 4 years, you can stay on for an optional 1-year internship and 3-year residency to gain a board certification in specialty. So if you wanted to become a specialized cardiologist or a specialized surgeon, you can stay on for additional education. I myself, after 8 years, I thought that was enough. And I was like, you know what, I'm going to go into private practice. And I've been very happy with that.
Then for the technician, I went to Kirkwood. They have a technician program there that is really great. You do have to take an entrance exam to get into most of the technician colleges. Usually it's just a 2-year accredited college. They have to be approved by the state to be a college. So you can't just go to like This Is Awesome College or .com or anything. They are accredited. And so it's just a 2-year degree with the summers in between. You're doing internships to get hands-on. And so after college too, you have to do a lot of continuing education every year to upkeep your registration, because you can kind of get grandfathered into a veterinary clinic to work at the level of a technician. But just coming in, you can come in as a registered veterinary technician and you kind of have all the skills you need, you know, right at the start of your job. In school, it seems like there's a lot that we learn that you're thinking, oh, wow, you know, this is for the doctors to know. But it is really helpful when you're assisting the doctor. You can kind of even start to learn what they need you to do kind of before they even get to see the patient. You know, you can see that an animal's here to collect urine or to be seen for urine issues, and you know to collect the urine. You know that that's connected to, you know, other parts of the body. It could be making them nauseous and whatnot. But the Kirkwood program was very good. They have animals at the facility for you to practice on. They work with the shelter over there. It's a pretty rigorous program, but I think it really did help kind of get us ready to pass that exam at the end to become certified for the state and the national exam. At the very end of college, you have to sign up. I think it's $300, at least it was when I took it. You have to take a big state and national test to become registered. And it's like everything you learned over those 2 years is in one test. And so you really, really get prepared for that. So.
And then kind of when it comes down to it, like what the numbers are about what your kind of financial state's going to be like kind of coming out of school. We've got some examples here. So for instance, a veterinarian, especially one that works in private practice with on-call, kind of like at our practice, you're going to work an average of probably 50 to 60 hours a week. So it's definitely not a 9-to-5 job. The average salary coming out of vet school right now is about $85,000 a year. And that's according to the AVMA. But the average debt coming out of vet school is also pretty high. It's about $150,000. So coming out of vet school with a lot of debt is an issue that I know AVMA and a lot of people are trying to work at, kind of narrowing that gap between the salaries and the debt load. But there are a lot of benefits you can get just at a normal kind of private practice job, just like any other job. We do get extra pay for our on-call time. We also have opportunities with health, dental, vision insurance, retirement plans. And then, you know, like myself, I've partnered in and bought into the practice. And so that's also an opportunity for a lot of people if you're interested.
And then for the technician side of that, kind of it, you know, according to some of the online kind of job average, like Indeed, you're going to make like $13.89 per hour. But it's kind of experience based. If you were to work 5 years at one clinic and then move somewhere else, they're not really going to start you at that kind of base pay. And then different clinics in different regions will pay more. And especially some clinics don't offer health insurance, and so they'll pay you a little more to kind of offset that. As a technician, your hours are a little bit more 9 to 5, where you're going to work on average 40 hours. Sometimes it might go a little bit over if if an emergency came in and you're the last technician there, you know, for the day, you might end up staying to help with that. But generally it's pretty routine. And then we do have kind of those extra benefits. One thing that's different for the technician and the veterinarian is, like McKenzie was saying, with the debt after school, you usually don't have too much debt in the technician side if you were a little bit well off or you had some saved for school. Generally, it's going to be kind of that. I think it was like $2,000 a semester. It's a lot easier to kind of budget, I think, in school for the techs to come out pretty low in debt.
And so things that you can prepare if you're interested in this career now, I mean, developing good study habits is really key. It's something that education wise, like it's, you know, you really need to learn how you can best study and learn for yourself. Working hard at that, and then taking lots of science and math courses, really on the job, kind of shadow experiences, internships. Obviously when we're not worried about COVID, but really getting those in-clinic experiences can be really helpful for you to figure out if this is the job for you.
Yeah, and I would agree with the technician side. You know, you might not, it might not be that your biology class is the same thing you'll need in, you know, biology for college, but having that foundation of learning how things work and kind of that mode of how the science of things is, if you can definitely use that when you get to college, figure out how to remember things like that.
And so some frequently asked questions we get asked, like, what do you like most about your job? What do you like least? And so real quickly, like for me, the thing I like most about my job is probably really the variety. You know, no 2 days are the same. And so being able to do something different every day is really, really fun. What do I like least about my job? You know, it can be kind of demanding or overwhelming at times with caseloads. I think the obvious thing that, you know, obviously part of what we do has to do with, you know, humane euthanasia and stuff like that, which is kind of a whole other topic, but that's obviously not a real fun thing to do, but it is a very important job of a veterinarian. The most exciting thing probably about my job is just really just not knowing when I walk through the door what's going to happen that day, which some people see it as a challenge as well, but being able to think on my feet and just kind of going with the flow and being flexible with the day, it just makes life really fun and exciting.
And kind of for me, I think human to human, it's going to differ on what you don't like having to deal with. This is a picture of me cleaning up some vomit from a dog who ate a bunch of chocolate, which a lot of people know is very toxic to dogs. So we had to make him throw up all of the chocolate because it was very recent. And it's just, I don't love vomit. It's very slimy and it was hard to pick up. And it was everywhere.
I believe that was after Valentine's Day, I think, one year. Yes. That was
so kind of those gross aspects, kind of the doctors get to kind of say, okay, I'm going to make your dog puke now. And then they walk away. So the puke and the poop and the aftermath of everything is kind of our job as the technician to clean up effectively and kind of quickly. So those aren't my favorite things. And kind of a part of that too is like ringworm, maggots, just all the gross things you will have to deal with if no one else is there. Sometimes you can push it off to other people, but you're going to have to deal with those things, and those are my least favorite. What I like most about it is kind of what MacKenzie said. You never know what you're going to get. I like to think of us as kind of detectives, you know, like an owner comes in and they say, my dog is vomiting and I don't know why. And so now it's our job to kind of do the work and figure out like what's going on. You know, we're kind of like doing our detective job and looking at different things, blood work, urine, x-rays, and trying to figure out why this dog is having this symptom. That's kind of what I like most and find most exciting is being a detective. So and definitely surgeries too. Surgeries are very fun, seeing the different things the doctors are doing or assisting with the different things. So
thank you so much for listening to our presentation. These are our email addresses here. If anyone has any questions or anyone has any interest in scheduling any job shadows or spending some time in a clinical setting, you know, please feel free to reach out and let us know.
Yep. Thank you.
Thank you, guys.